Welcome to the HIPAA training module developed for the Beckett family of services, which covers employees of Beckett Academy, the Vermont Permanency Initiative, Mount Prospect Academy, and the Mountain Valley Treatment Center. These organizations will be referred to collectively in this training as the company. As an employee of the company, you are required to complete HIPAA training during initial onboarding and orientation and annually thereafter for as long as you are employed by the company. In order to receive credit for completing this training, you must also read, understand, and agree to comply with the company's HIPAA policy and technology access policy, and sign a HIPAA compliance and technology use agreement, which is located in the employee's self-serve web portal. Annual HIPAA training is required by federal law. Failure to complete annual training may result in sanctions up to and including dismissal from employment. HIPAA stands for the Health Insurance Portability and Accountability Act. Part of the original legislation encouraged the healthcare industry to computerize patient records, which made those records vulnerable to online theft and misuse. As a result, additional rules became necessary to safeguard patient information. The privacy and security rules offered strategies for securing protected health information but lacked provisions to enforce compliance. The enforcement rule on high-tech provided additional guidance regarding the security of patient records and gave the U.S. Department of Health and Human Services the power to investigate complaints and levy fines for noncompliance. The American Recovery and Reinvestment Act included additional provisions to support data security, and the Omnibus Final Rule filled gaps in existing HIPAA rules and imposed stiffer penalties for noncompliance. HIPAA compliance training focuses on those aspects of these federal rules and acts that regulate the disclosure of protected health information. In this training, I'll refer to all of these various acts and rules simply as the HIPAA rules. Who must comply with HIPAA rules? Anyone who has access to protected health information, and this includes covered entities, which the HIPAA rules define as any person or organization that provides, bills for, or is paid for healthcare services. This designation includes employees of covered entities, and compliance requirements continue indefinitely. In other words, you are prohibited by federal law from disclosing protected client information ever, even after you stop working here. HIPAA rules also apply to business associates and subcontractors that have access to our clients' protected health information. In our case, this would include technology service providers, accountants, and even the document disposal companies we might hire to shred our old client records. This training doesn't specifically cover business associate and subcontractor obligations under HIPAA, so you should contact your HIPAA liaison or the company HIPAA compliance officer if you want more information about these topics. Protected health information, or PHI, includes any information that can be used to identify a client, whether living or deceased, that relates to the client's past, present, or future physical or mental health, including healthcare services provided and payment for those services. The term individually identifiable data sometimes is used to describe the types of information that qualify as PHI. Examples of this include client names and the names of their relatives, photographs or images, contact information such as addresses, phone numbers, fax or email, social security numbers, credit card numbers, billing information, insurance information including policy numbers, medical information such as diagnosis or treatment notes, healthcare record numbers, any other client-specific account numbers, biometric identifiers such as fingerprints or voice prints, or any other unique number, code, or characteristic that can be linked to an individual or used to identify the individual. Why does the law protect PHI from unauthorized disclosure? Well, lots of reasons. Protected information could be used to discriminate. For example, if a prospective employer were to learn that you are being treated for a complex, potentially debilitating medical condition, the information might compromise your prospects of being hired. There's an embarrassment factor, too. You wouldn't want the receptionist at your doctor's office to announce across a crowded waiting room what medical condition your doctor will be treating today. Beyond that, medical records are a hot commodity on the black market and are in higher demand even than credit card or bank account information. This is because people are relatively quick to notice fraudulent charges made to their financial accounts, but they are much slower to notice when their medical records have been compromised. It can take years for someone to notice a breach of medical records, and in that amount of time, the stolen information can be used in all sorts of nefarious ways. Insurance information can be used to fill fraudulent prescriptions for medications that have a high value when resold as street drugs. Names and social security numbers can be used to secure and max out new credit cards or to commit tax return fraud. By the time someone notices there's a problem, their name and reputation may be seriously damaged, making it difficult to secure credit or apply for a loan. Counteracting medical identity theft can be very costly and time-consuming. HIPAA rules authorize the company to use protected health information as necessary to treat clients, bill for services, and maintain normal business operations. Clients or their parents or legal guardians are entitled to see or request a copy of their treatment file. The protocol for responding to such requests is not covered in this training, so you should notify your program's HIPAA liaison immediately if a client asks about this. Anyone authorized by the client or his or her parent or legal guardian may access PHI. Authorization must be given in writing and must include the intended recipient's name as well as the specific types of information that may be shared. Securing authorization for disclosure of protected information is part of the client intake process that includes filling out and signing a HIPAA information use and authorization form. Note that if a client is 18 or older, we cannot disclose protected information to his or her parent or guardian without the client's written permission. We must disclose protected health information as required by law, such as is required to report suspected child abuse or neglect. Lastly, if a client is transferred to another covered entity for continuation of services, we may transfer PHI to facilitate continuity of care. HIPAA rules require that we track who accesses protected health information, and this means that we must maintain a log of all requests for disclosures. The HIPAA rules have a minimum necessary information standard. From a disclosure perspective, this means we should release only that information necessary to accomplish the intended goal. For example, if we're responding to an authorized request for a client's treatment goals, we can release the treatment goals, but not other client PHI, such as treatment notes, incident reports, or billing information, which would be irrelevant to the request. From an employee access perspective, company employees may access the information they need to do their jobs. This is known as role-based permission, and it's tied to specific job responsibilities. A clinician will need to access clinical records, but probably not billing information, whereas billing staff will need to access insurance policy numbers and a list of billable services provided, but probably not day-to-day treatment notes or incident reports. HIPAA safeguards are divided into three categories: technical, physical, and administrative. There are specific compliance requirements for each of these categories, and in addition, the company must conduct regular internal audits to determine how well our safeguard systems are working and to identify and address any weaknesses we might find. Technical safeguards include 5 requirements: access controls, audit controls, integrity, authentication, and transmission security. Audit controls require that automated systems run in the background to conduct periodic risk assessments of device security, to track who accesses which information and when, and to flag suspicious activity for investigation. The integrity of PHI is protected with systems and procedures that limit access and track who adds, edits, and views client information. Authentication involves the use of strong, secure passwords that are updated regularly. And transmission security involves the safe sharing of electronic files containing ePHI, as well as accessing the company's network in ways that do not compromise its security. Files saved to Office 365, including SharePoint and OneDrive, are secure and can safely be shared with others who are authorized to access the company network. The same is true of files saved to Kaleidocare or in BestNotes. Documents saved to publicly available file sharing sites are not secure and should be avoided, and this includes sites like Google Docs and Dropbox. Protected information that is emailed from one company employee to another using work email addresses is secure. However, other email services aren't necessarily secure, so files being sent to Comcast or Gmail or other non-Beckett or non-Mountain Valley addresses must be encrypted. Employees who frequently send protected information by email should ask their supervisor for access to company-supplied, easy-to-use encryption software. One more thing about transmission security. Be careful how you access the internet. Accessing the internet by logging into a company-owned Wi-Fi network using a company-issued computer is great because the system is secure and the computer has the required security software in place. And using a company-issued computer on a known, secure, password-protected VPN, virtual private network, such as your home internet service is fine too. However, public Wi-Fi connections, such as you might find at the airport or at a coffee shop, are not secure and should not be used. Encryption is your get-out-of-jail-free card when it comes to HIPAA compliance, because HIPAA rules only apply to the disclosure of unencrypted information. This means that if it isn't stored in Office 365, SharePoint, OneDrive, KaleidoCare, or OneNote, it should be encrypted. It also means do not store protected health information on your computer's desktop. Do not store protected health information on any device not provided by the company, and this includes your home computer, privately owned laptop or tablet, or privately owned phone. Do not store protected information on a thumb drive or other portable storage device without encrypting it first, and do not check your company email on your privately owned computer, tablet, or phone. And do not check your private email on your company-owned device. Physical safeguards fall into 4 categories. Facility access controls include physical barriers to keep unauthorized people from accessing places where protected health information is stored, and also include strategies to access client information in the event of an emergency. By storing client information virtually in a secure location on the cloud, we achieve both of these goals. Only authorized users with login credentials can access our client PHI, but they can do so from anywhere, so work can continue in one of our offices even if it is destroyed or cannot be accessed because of an emergency. Physical security strategies vary from one program to the next and include locks, keys, swipe cards, and digital passcode entry systems. However, these physical systems only work if we use them, so lock doors and windows when you leave your office. If an unknown person asks for access to the building, even if they have a logical explanation, validate that they're authorized to be there before you let them in the door. So, for example, if someone tells you they've come to work on the server, contact the technology provider and confirm that someone actually is scheduled to work on the server before providing access. Workstations are protected by secure passwords, but again, these only work if we use them. And they only work when we take steps to make sure others can't see what we're working on, so be sure your workstation is situated where passersby can't look over your shoulder. When you get up from your desk, log off your computer. If there are paper files on your desk, lock them in a drawer when you leave the area. Never give anyone your password or log in for them and let them use your work computer. The same goes for other electronic devices. Physical safeguards for device and media controls involve the proper removal of PHI before a device is disposed of or reassigned. This is necessary because simply erasing a file or tossing it into the electronic recycling bin does not get rid of it. Our IT department has HIPAA-compliant processes in place for wiping devices prior to disposal and reassignment. Administrative safeguards cover all of the various policies, procedures, processes, risk analyses, and training that we as a company have put in place to ensure that we are compliant with HIPAA requirements. While maintaining compliance with our company HIPAA policy is everyone's responsibility, the security management process is overseen by the company HIPAA compliance officer with support from individual program-level HIPAA liaisons. Network security related to our HIPAA policy is overseen by our technology provider, and device management and tracking are automated using the employee self-service system. Workforce security and information access management includes policies and procedures governing role-based permissions, access requirements, and steps to be taken to shut down access to a device when it is lost, stolen, or when an employee is terminated. Security awareness training includes annual HIPAA training as well as updates on changes in HIPAA rules and periodic security reminders and alerts. Security incident procedures govern the company's response to suspected or known security incidents and requirements for documenting security incidents, developing and implementing remediation plans, and conducting follow-up. The company's contingency planning strategy is based on the cloud-based backup of records discussed earlier in this training. Evaluation involves the regular testing and revision of procedures to ensure their effectiveness. In most cases, this testing will occur electronically and won't be noticeable. Business associate contracts and other arrangements, including documentation of satisfactory security assurances, are maintained by the business office and shouldn't impact employee HIPAA compliance activities. A HIPAA breach is defined as the acquisition, access, use, or disclosure of unsecured PHI in a manner not permitted by HIPAA, which poses a significant risk of financial, reputational, or other harm to the affected individual. Breaches may be verbal, electronic, or paper, and they may be accidental or intentional, and includes lost or stolen or improperly disposed of PHI. Suspected HIPAA breaches should be reported to your program's HIPAA liaison immediately. If your HIPAA liaison is not available, report your concerns to the company HIPAA compliance officer. It is illegal to harass or penalize someone for reporting a possible HIPAA violation, so you should not fear retaliation. However, if you have concerns, you may submit a HIPAA complaint form anonymously by using the scan to email function on your program's printer. As soon as a potential breach is reported, immediate steps will be taken to secure the situation and prevent the breach from causing additional unauthorized disclosure of protected information. So, for example, if the breach involved unauthorized access of a computer file due to pirated passwords, the system would be frozen and the passwords changed. Once the situation has been secured, the company will initiate a breach investigation to determine what, if any, protected information was disclosed, how the breach occurred, and what can be done to prevent similar breaches from happening again in the future. If required, a report will be submitted to the Department of Health and Human Services and to the client whose protected information was disclosed. Follow-up will be conducted to ensure that the mitigation plan has been implemented properly and that it has achieved its desired result. As an employee, you are required to cooperate with breach investigations to the best of your ability if requested to do so. A HIPAA breach can trigger an external audit by the Federal Department of Health and Human Services Office for Civil Rights, OCR. Depending on the audit findings, fines may be imposed as well as criminal and civil penalties, sanctions, or even loss of licensure for the company or for the individual employee who improperly accessed or disclosed protected information. Under HITECH, state attorneys general are permitted to bring civil actions and recover monetary awards that may be shared with harmed individuals. In addition to federal HIPAA rules, individual states have their own rules and regulations governing the disclosure of PHI and their own penalties for noncompliance. Harmed individuals can file lawsuits on their own behalf, and on an organizational level, employee noncompliance with the company's HIPAA policy can lead to disciplinary action up to and including termination. HIPAA breaches can be incredibly costly depending on the severity of the breach and whether it could or should have been prevented. Fines range from $100 per disclosed record up to $50,000 per record, with a maximum of $1.5 million per year. In addition to fines, there are costs associated with breach investigation, implementation of remediation strategies, breach notification letters, lost business, class action lawsuits, and other ancillary expenses. The moral of the story is that prevention is better than remediation, and employee compliance with company HIPAA policy is essential if we are to prevent breaches from occurring. The Office for Civil Rights reports that the most common reasons for HIPAA violation citations include employees intentionally disclosing information, such as gossiping about clients to friends or coworkers or posting protected information or client pictures to social media, mishandling of paper records, such as leaving paper files unsecured, putting a file in the wrong client's folder, accidentally giving a file to the wrong person, or tossing paper containing PHI right in the trash rather than shredding it, lost or stolen computers, tablets, phones, or storage devices such as thumb drives that have had their security passwords disabled or contain unencrypted information, unsecured sharing of PHI caused by emailing unencrypted files, using unsecured wireless networks, using public documents sharing sites such as Google Docs, or texting patient information. Employees illegally accessing client information out of curiosity, spite, or as a favor to relatives or friends, or using PHI for personal gain. Unauthorized disclosure of information caused by not checking to see if the intended recipient is actually authorized to receive the information, sending information to the wrong address or email, or leaving a phone message at the wrong phone number. And external threats such as malware, ransomware, hacking, phishing, or other schemes that infiltrate the system when an employee clicks on an infected website or email attachment. This concludes your annual HIPAA training. If you have any questions or if you'd like additional information, please contact your program's HIPAA liaison or the company's HIPAA compliance officer. If you aren't sure who to contact, use the company's HIPAA email address, which is hipaa@beckett.org. Be sure to sign and submit your HIPAA compliance agreement so that you can get credit for this training. And thank you.